This is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond, and it is Video Wednesday. And I am coming to you today from my bed. And okay, I have a little affinity for purple. I love it. And I have my nice little purple fleecy furry blanket on my bed and some pillows because today I woke up and I was like, man, I'm not really sure what I want to tell the mamas today. It's Video Wednesday. I don't really have a topic. But you ever wake up and you're kind of stiff? And I'm like, what the heck is that? I mean, I slept well, had a great night's sleep, but I was stiff. And so I said, well, before I do this video, let me go and do some yoga. And it was great because it was just what I needed to get the stiffness out of my hips and to then think, well, if I'm stiff from just one night in bed, how stiff can mamas on bed rest be, and what can we do? Now, granted, my yoga class was probably quite a bit more than I would have you mamas on bed rest do, but the yogi who was teaching the class was excellent, and it gave me great ideas to just share with you how to give your hips some relief as you're laying here on bed rest. And what's the deal? Why you would think you're in bed. Why aren't you comfortable? Why aren't you feeling great? Why aren't you getting excellent rest? You have to go back to the reality of the pregnancy and that your body is doing some incredible things right now. First and foremost, you have your uterus, which is, hanging out here in your pelvis, and depending on where you are in your pregnancy, has now raised up into the abdominal cavity, and it's expanding. And what that's doing is it's pulling on the uterosacral ligaments as well as the broad ligaments. The broad ligaments suspend the uterus in the lower back. The uterosacrals hold it in the pelvis. So these ligaments are now softening because of the relaxin, the hormone that's relaxing the soft tissue and the tissues in your pelvis to allow the expansion. And so they're going, and everything's kind of expanding. This is a good thing because if you didn't expand, you can have a successful pregnancy. But at the same time, what's happening is your muscles are going, hey, wait, she's supposed to be held here. So like your psoas muscles and some of your side muscles, they're all going, well, let me clamp down to hold her where she's supposed to be. So there's this push-pull between the soft tissues that are relaxing and stretching to allow the growth of the pregnancy and the kind of clamping down of your muscles that are saying, oh, wait, we're supposed to hold her in this particular upright position or keep the legs within the hip sockets and etc. And it's causing tension in your body. So you're waking up like, bleh, because your hips are hurting, your legs may be hurting, your low back may be hurting, uterosacrals and broad ligaments are stretching, back muscles and hip muscles are contracting, and there's just all this kind of melange of tension going on. I had some of it this morning, probably definitely not to the degree that you're having it, but I wanted to share with you some of the things that my yoga teacher was doing. I was thinking, oh my God, this would be perfect for mamas on bed rest. And so this video is all about just getting some relief for your hips while on bed rest. So first thing I'm going to do is, and they're really easy, and I think there are some things that you should just keep in mind while you're laying in bed. And we always talk about proper pillow support, which is why I've got several pillows on the bed, and just supporting these pressure points as you're sleeping, as you're resting, because you may not be asleep. So I'm going to scoot back here onto my bed. And remember, there are some rules here for being on bed rest. When you're pregnant, after about 14 weeks, we do not lay flat on your back because the growth of the fundus can compress on the inferior vena cava, which runs up the right side of the body, bringing blood from the lower part of the body back up to the heart. It's this long tube. If the uterus clamps down on it, it's like kinking a garden hose. You're not getting blood up to your head. This is not a good thing. Not to your head, but back to your heart. Not a good thing. So we don't want to compress the inferior vena cava. So we always want to be kind of in a reclined mode. So I've got all my pillows here. And you just lay back. Now, in this recline mode, you're not putting that pressure on the inferior vena cava. So you can be kind of relaxed. You're laying here. And what the yogini in my class had us do today was the first thing he said, just lay back and relax, palms up. Put your soles of your feet together and then just relax. And I remember thinking, oh my God, that felt so good. And this might be just the thing that for you mamas on bed rest you also need, because your hips just, we're talking about that push-pull between the expansion and the stretching of the soft tissue, the very soft tissues, the ligaments and tendons, and then the kind of clamping down of the muscles trying to hold you in place. And this can be very comforting. Now, if it's too much for you to just kind of go from here to flop, you can put pillows up under your knees, but just to give you that complete surrender. You can also use, now this is a body pillow, you can put that up under your knees, and I suggest doing this anyway as you're laying on bed rest, because that will also support the low back. It seems crazy, you're putting it under the knees, but it does in fact allow the low back to relax into the mattress. So you can put, if you don't have a lot of extra pillows, you can put the long body pillow up under your legs, put the soles of your feet together. Now you're not going to pick your feet up like this, I'm just doing this so that you can see. Put the soles of your feet together and then just let your legs flop open. This is a very, very soothing and comforting position for your hips, and you will find that it just gives a lot of release and a lot of lack of pressure on your hips and your lower back, and you can just kind of relax into it. And you're laying here, and it's really a nice stretch for your legs. Now, if you want to do something a little more active, and you have to be sure that you check with your OB or midwife before you do any of these, because if you're on like a modified bed rest, there are things you're going to be able to do. If you're on strict, there are things that you're just not going to be able to do. The one we just did with the legs open like this, that's pretty much open to everybody. Most OBs and midwives will say, not a big deal. This one can be depending on your indication for bed rest. But again, we're going to modify it in such a way that it should be okay for everyone. But again, check with your OB or midwife before you do this. So you're laying here in bed, and you're propped up so you're not on the inferior vena cava, and you want to give just a little stretch to your thighs and your hips. So you can have one leg extended, and again, I would say maybe have the pillow up under your leg to give some support to the leg, to the hip, and to the lower back. You can bring the other knee up. And again, now I'm going to bring mine in pretty close. I'm not pregnant, little chunky, but not pregnant. So I can bring my leg in further. You may find that you have to bring your leg out to the side, or that you can only bring it this far. But then what you're going to do is just reach down and grab around the lower leg here. Now again, being pregnant, this may not work real well. To help with that, you can either use a belt, you can use a towel, you can use an exercise band if you have one handy, or if you can reach down, and you can also do it out to the side and just hold that leg. But depending on where you are in your pregnancy, and if you were like me when I was pregnant with my son, I went straight out. There was no way I was getting my hands around my leg like this. So I would recommend, and I'm trying to see, did I leave my towel in here? Let me see, I had a towel. Oh, here it is. Oh, hold on one second. I do have a towel. So what you can do is you take the towel, and that gives you a little extension of your hands. You put it around the bottom of your feet. Now this is just a little hand towel. You can also use a bath towel, and you take it, and then you just bring your knee towards your chest. Again, it's not this situation where you're trying to bring it in really tight and you're grinding down. No, we're not doing that. We're just trying to get a little bit of stretch and a little bit of opening in the hip. You can also allow the hip to roll out if that's comfortable for you, and you can have it straight in. But again, it just gives a little bit of stretch and a little bit of activity to that hip. And always you want to be balanced, so you can come over to the other side. Now here is this is my left now that I'm doing. Bring it in, you can stretch it out a little bit. And the towel, again, towel, belt, or exercise band will just give you that little bit of extra arm length that you're going to need to be around your belly, because you're pregnant and you got a person in there, you got to be careful. So that is that way to stretch. So you can lay here, you can stretch what I call froggy-legged. If you need the extra support, you put the body pillow under your legs, let them rest on the pillow, give that opening to the hips, and then you can use the towel to do single leg knees, bringing them into your chest. Now the other, there are a couple other things. These are a little more advanced. Well, this one's not more advanced. We're going to start with the one that's a little bit easier. And it's the same type of frog leg thing. And what I'm going to do is I am up on all fours. Now, again, you have to check with your midwife or your OB. They may not want you up like this, but you may find this is comfortable while you're sleeping. And what I'm doing is I have my knees up under me. I have my toes together. So my big toes are together. My heels are out. So my heels are kind of here. Let's see. My heels are up under my butt. So my feet look like this, if you can see it. And then what I'm doing is I'm opening my legs. So let's see if I can do it here. So my legs are open this way, kind of a fairly broad V. And you have to do this because you have to allow space for the pregnancy. So I'm on my side here. And then I'm going to take an extra pillow. And I'm going to actually pull it down. And then I'm just going to go this way. Now, the other thing about this is this also gives a lot of nice release to the lower back and to the hips. And you can just lay here and relax. This is very, I do this and I'm not pregnant, but sometimes my hips just lock up. I cycle a lot. And if I go on a long ride sometimes, after I ride and I've showered and everything, and then I'll sit down, maybe at the computer or whatever, I go to get up and my body's kind of like, not so fast, sister. So I have to kind of stretch it out. And this is one of the stretches that I use. So my big toes are together like this. My heels are like this part. And then I'm just kind of sitting on my heels. My knees are out like this. And you just rest. And if you're really lucky, you have a partner or a friend come by and they can rub your lower back right here in the sacrum. Just put a little pressure there. That feels wonderful. Now, the other thing about this position that's really nice, and I don't have an exercise ball here or a birth ball available right now, and we'll do this again sometime when I have my birth balls, is you can lean on the birth ball. This is a great way to labor. And essentially it's like this, like say these are all the birth balls, and you can just lay on them and you can hug the birth balls and just release your hips and allow the contractions to open you up and to allow the passage of the baby. Now finally, I'm going to throw this in. This is probably an advanced move and many of you are not going to be able to do this, but I want to show it to you in the event that you have kind of a more modified bed rest as opposed to strict bed rest. And again, it's kind of, it's a squat and it's very good for your hips, but it is not for everyone. You must check with your OB or your midwife to make sure that you have the privilege to do this. It should not put any pressure on the lower abdomen, but again, I don't know your situation, definitely check. But you get up on your feet and you do it so that your feet are flat on the bed. Now my feet are pretty flat and my arms are on the inside of my knees and I'm just sitting here. And it's a really great hip opener. Now if you're not feeling real confident about this, what you can do is you can back yourself up to your pillows, lean back into your pillows, and then put your hands down like this. Now, again, this may be hard for you depending on the size of your pregnancy. This is a really good exercise to do with a birth ball, which I don't happen to have available right now, but it is a wonderful exercise to do with a birth ball. You can do it with the body pillow. You scooch up the pillow and you hold on to the pillow. But the whole point of it is to allow you to open up your hips and to rest in your hips and let them just kind of get some air in there and some blood circulation, some movement. So often when you're on bed rest, you're laying. And you're laying kind of on your left side and you're all kind of squinched in and contracted. Or you might be laying this way, but you're really not doing a lot. And things are just kind of not moving. When you can get a little bit of air, a little bit of extra circulation in there, things are going to move so much better. And you are going to get some relief. And it may be you just do these stretches like 10 minutes a day. That's it. That might be all that you need. Or it may just be a variation for you to have some more comfort while you're in bed. regardless of how or why you do these, you want to give that relief to your hips, because I mean, when your hips hurt and you're pregnant and you're getting bigger, it's just really, really uncomfortable. And it just was really driven home to me today after having a great night's sleep, but waking up with hip stiffness and pain. And I was like, gosh, what about ladies who have been on bed rest, 5, 10, 20 weeks? How stiff are their hips? So I just wanted to share these stretches with you that my yogini did with us, and we did so much more in yoga class, but that you can do while you're in bed and give yourself some relief in your hips. So that's it for today, our Video Wednesday. I'm Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. I really hope these exercises help you. Do check in with your OB or midwife before you do them, and have a great day and a great pregnancy. Let me know when you deliver, and let me know if you have any other really great hip exercises that you can share with us. You can put it on, we would love to see them in the comment section on this blog. Share them with your friends, share them with our community, and let some other mamas benefit. So thank you so much. Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond. Thank you.